Welcome to This Week in Medicine, your filtered medical journal summary. Looking to stay up to date with the latest medical research but short on time? This Week in Medicine has you covered. Our AI-generated podcast provides you with a convenient, on-the-go solution to keep you informed about the most significant developments in the medicine field. Each episode offers a filtered and concentrated summary of key journal articles, allowing you to stay informed without the need to sift through pages of research papers. With This Week in Medicine, listening is faster than reading, and you can consume valuable medical knowledge while commuting, exercising, or during your daily routine.
Hi, This Week in Medicine, we will be discussing. First, we will be discussing articles in New England Journal of Medicine. Phase 3 trial of semaglutide in metabolic dysfunction-associated steatohepatitis. Background. Semaglutide, a glucagon-like peptide-1 receptor agonist, is a candidate for the treatment of metabolic dysfunction-associated steatohepatitis, MASH. Conclusions. In patients with MASH and moderate or advanced liver fibrosis, once-weekly semaglutide at a dose of 2.4 mg improved liver histologic results. Next article. Navigational bronchoscopy or transthoracic needle biopsy for lung nodules. Background. Each year, millions of pulmonary nodules are identified incidentally or through lung cancer screening, and many involve biopsy to distinguish cancer from benign processes. Both navigational bronchoscopy and computed tomography-guided transthoracic needle biopsy are commonly used in patients undergoing biopsies of peripheral pulmonary nodules, but the relative diagnostic accuracy of these two approaches is unclear. Conclusions. The diagnostic accuracy of navigational bronchoscopy was non-inferior to that of transthoracic needle biopsy among patients with peripheral pulmonary nodules measuring 10 to 30 millimeters. Next article. Omitting regional nodal irradiation after response to neoadjuvant chemotherapy. Background. The benefit of regional nodal irradiation in the treatment of breast cancer is well established for patients with pathologically positive axillary nodes, but whether it is also beneficial for patients whose nodes become pathologically tumor-free, EPN0, after neoadjuvant chemotherapy remains unclear. Conclusions. The addition of adjuvant regional nodal irradiation did not decrease the risk of invasive breast cancer recurrence or death from breast cancer in patients who had negative axillary nodes after neoadjuvant chemotherapy. Next article. A trial of Trimethoprim sulfamethoxazole in pregnancy to improve birth outcomes. Background. Maternal infections underlie several adverse birth outcomes. Whether trimethoprim sulfamethoxazole prophylaxis during pregnancy will improve birth outcomes is unknown. Conclusions. In Zimbabwe, trimethoprim sulfamethoxazole prophylaxis during pregnancy did not significantly increase infant birth weight. Next, we will be discussing articles from Journal of American Medical Association. Clinical validation of a circulating tumor DNA-based blood test to screen for colorectal cancer. Question. What is the clinical performance of a circulating tumor DNA-based blood test for colorectal cancer detection in average-risk individuals? Findings. This prospective population-based observational study enrolled 48,995 participants, aged 45 to 85 years at average risk of colorectal cancer. In a cohort of 27,010 evaluable participants, the blood test demonstrated 79.2% sensitivity for colorectal cancer and 91.5% specificity for advanced colorectal neoplasia, using colonoscopy as the reference standard. Meaning in this large diagnostic accuracy study evaluating a colorectal cancer screening test, the blood-based test demonstrated acceptable accuracy for colorectal cancer detection in an average-risk population and provides an additional option for colorectal cancer screening. Next, we will be discussing articles from Annals of Internal Medicine. Effects of a hypotension avoidance versus a hypertension avoidance strategy on neurocognitive outcomes after non-cardiac surgery. Background. Perioperative hemodynamic abnormalities have been associated with neurocognitive outcomes after non-cardiac surgery. Objective. To compare the effects of perioperative hypotension avoidance versus hypertension avoidance strategies on delirium and 1-year cognitive decline after non-cardiac surgery. Conclusion. There was no evidence of a difference in neurocognitive outcomes between the hypotension avoidance and hypertension avoidance strategies. Next, we will be discussing articles from Lancet. Comparison of supplemental breast cancer imaging techniques. Interim results from the BRAID randomized controlled trial. Background. It is not known which supplemental imaging technique is most beneficial for women with dense breasts attending breast screening. This study compares abbreviated MRI, automated whole breast ultrasound, ABUS, and contrast-enhanced mammography versus standard of care in women with dense breasts and a negative mammogram. We report on interim results from the first round of supplemental imaging and interpretation. Abbreviated MRI and contrast-enhanced mammography detected 3 times as many invasive cancers compared with ABUS, with cancers being half the size. This study shows that supplemental imaging could lead to earlier detection of cancer in women with dense breasts, but does not estimate the level of overdiagnosis. Next, we will be discussing articles in the field of hemato-oncology. Here are the articles from Journal of Clinical Oncology, explaining the relationships between age, endocrine therapy persistence, and risk of recurrence in hormone receptor-positive early breast cancer, a nationwide cohort study. Purpose. Young age is associated with increased risk of recurrence in hormone receptor, HR-positive early-stage breast cancer, EBC. Lack of adherence to endocrine therapy, ET, is a potential reason for the lower survival proportions observed in younger patients, but the survival benefits of improving adherence to ET in young patients remain unknown. Here are the articles from Journal of Hepatology. Utility of AI digital pathology as an aid for pathologists scoring fibrosis in MASH. High inter- and intra-pathologist variability is a significant challenge in MASH scoring. The use of artificial intelligence, AI, digital pathology, DP, to aid pathologists in fibrosis scoring, improves inter-pathologist variability. This increases confidence in inclusion and exclusion for clinical trials and treatment response evaluation. The use of AI DP holds the potential to improve clinical trial efficiency. Next, we will be discussing articles in the field of gastroenterology. Here are the articles from Gastroenterology. Human enteric glia diversity in health and disease. New avenues for the treatment of Hirschsprung disease. Background and aims. The enteric nervous system, ENS, which is composed of neurons and glia, regulates intestinal motility. Hirschsprung disease, HSCR, results from defects in ENS formation. However, although neuronal aspects have been studied extensively, enteric glia remain disregarded. This study aimed to explore enteric glia diversity in health and disease conclusions. 2 major enteric glial classes were identified in the pediatric intestine, highlighting the significant postnatal contribution of Schwann-like enteric glia to glial heterogeneity. Crucially, these glial subtypes persist in ganglionic segments of patients with HSCR, offering a new target for their treatment using 5-HT agonists. Here are the articles from Clinical Gastroenterology. The complex relationship between pain, mental health, and quality of life in patients with cirrhosis undergoing liver transplant evaluation. Goals and background. Patients with cirrhosis undergoing liver transplant evaluation have high rates of pain and mental health comorbidities. Both may significantly impair health-related quality of life, HRQL. We investigated the association between pain, anxiety/depression, and HRQL in this population. Conclusions. Pain is present in over 70% of patients with cirrhosis undergoing liver transplant evaluation. Anxiety and depression were highly correlated with pain and appeared to be key drivers in predicting poor HRQL. Evaluating and managing mental health comorbidities should be explored as a strategy to improve HRQL in patients with cirrhosis and pain. Next, we will be discussing articles in the field of infectious diseases. Here are the articles from Clinical Infectious Diseases. Association between delayed broad-spectrum gram-negative antibiotics and clinical outcomes. Background. Clinicians often start unnecessarily broad-spectrum empiric gram-negative antibiotics out of the concern that delaying effective therapy could lead to a worse clinical outcome. This study examined the consequences of delayed initiation of broad-spectrum gram-negative antibiotics. Conclusions. On average, among a large sample of adult inpatients who ultimately received broad-spectrum antibiotic therapy, delaying initiation of a broad-spectrum antibiotic was not associated with worse outcomes. Although broad-spectrum empiric therapy is undoubtedly sometimes warranted, this finding challenges the common belief that it's safer to err towards overly broad-spectrum empiric antibiotic therapy. Next, we will be discussing articles in the field of rheumatology, prevalence of frailty and associated factors in a U.S.-wide cohort of rheumatic diseases. Objective: we quantified the prevalence of self-reported frailty and identified associated factors in a U.S.-wide cohort of people with rheumatic and musculoskeletal diseases, RMDs. Conclusion: frailty was present in 1 in 3 participants with RMDs, a higher prevalence than estimates from the general population, and primarily manifests as difficulty with mobility. Disease severity was consistently associated with an increased odds of frailty across RMDs. Future interventions to improve physical activity and prevent disease damage may improve frailty status in people with RMDs. Next, we will be discussing articles in the field of cardiology. Here are the articles from Journals of the American College of Cardiology. Disentangling the impact of adiposity from insulin resistance in heart failure with preserved ejection fraction. Background: obesity, insulin resistance, IR, and diabetes are common in heart failure with preserved ejection fraction, FPEF, and are associated with worsening heart failure, but their independent contributions remain unknown. Hg, 95% C, plus 0.11 to plus 0.27 mm Hg per kilogram/m2, P less than 0.0001, but diabetes was not. Conclusions: excess adiposity is present in most patients with HFpEF, even among those not considered obese according to BMI, calling for further study of cardiometabolic therapies among patients with HFpEF and excess adiposity with BMI less than 30 kg/m2. Although excess body fat is associated with IR and diabetes, cardiac remodeling, hemodynamics, and functional impairment are independently correlated with body fat, but not IR. These findings suggest that diabetes is primarily a marker of greater adiposity in HFpEF, with less direct impact on heart failure severity. From JAMA Cardiology: sex-specific association of myocardial fibrosis with mortality in patients with aortic stenosis. Question: are there sex-related differences in the extent of myocardial fibrosis in aortic stenosis, AS? And does myocardial fibrosis provide important prognostic information in both women and men? Findings: in this study, women with severe AS had a similar extracellular volume fraction but less replacement fibrosis compared with men. Both extracellular volume fraction and replacement fibrosis were associated with increased post-aortic valve replacement mortality in women as well as in men, meaning these results demonstrated that non-invasive fibrosis assessment using cardiovascular magnetic resonance may improve risk stratification and decision-making in both women and men with AS. Next, we will be discussing articles in the field of endocrinology. Here are the articles from Diabetes Care: cardiovascular and kidney outcomes and mortality, with long-acting injectable and oral glucagon-like peptide, 1 receptor agonists in individuals with type 2 diabetes, a systematic review and meta-analysis of randomized trials. Background: glucagon-like peptide 1 receptor agonists, GLP-1 RA, reduce the incidence of major adverse cardiovascular events, MACE, in type 2 diabetes, T2D, although whether benefits extend to both subcutaneous and oral formulations remains unclear. See conclusions. As a group, long-acting GLP-1 RA, including both injectable and oral formulations, reduce incidence of MAC, HHF, and kidney events and all-cause mortality in T2D. Next, we will be discussing articles in the field of neurology. Here are the articles from Neurology. Association of non-modifiable risk factors with Alzheimer's disease blood biomarkers in community-dwelling adults in the ESTER study. Background and objectives. Dementia-related blood biomarkers are the future of large-scale dementia risk stratification. However, the extent to which phosphorylated tau, p-tau181, neurofilament light, NFL, and glial fibrillary acidic protein, GFAP, are associated with non-modifiable risk factors has yet to be confirmed in the community, and the role of menopause has yet to be investigated. Therefore, the aim of this study was to examine the association of age, sex, API-4 status, and menopause, with dementia-related blood biomarker levels, p-tau181, NFL, and GFAP, and rate of change over 11 years in longitudinal biomarker measurements in community-dwelling adults discussion. This population-based study on dementia biomarkers found that p-tau181 was dependent on age and API-4, NFL on age and sex, and GFAP on age, sex, API-4, and menopause status. GFAP levels and rate of increase were higher in women, especially in premenopausal participants. Future research should confirm these findings and further explore the role of menopause in dementia pathogenesis among women. Next, we will be discussing articles in the field of pulmonary and critical care. Here are the articles from CHEST. Clinical efficacy of serum antiglycopeptidolipid core IgA antibody test for screening nontuberculous mycobacterial pulmonary disease in bronchiectasis. Background. The serum antiglycopeptolipid core IgA antibody test has been proposed as a diagnostic tool for Mycobacterium avium complex pulmonary diseases. Cross-reactivity with other nontuberculous mycobacteria, NTM, including Mycobacterium abscessus, indicates that it may have a role as a broader screening test for nontuberculous mycobacterial pulmonary disease, NTM-PD. NTM-PD is believed to be underdiagnosed in patients with bronchiectasis. Research question. Can the serum antiglycopeptidolipid core IgA antibody test be used to screen for NTM-PD in bronchiectasis? Interpretation. The antiglycopeptolipid core IgA antibody demonstrated excellent efficacy in screening for NTM-PD in a large cohort of patients with bronchiectasis. Here are the articles from the American Journal of Respiratory and Critical Care Medicine. Impact of the Capture Chronic Obstructive Pulmonary Disease Screening Tool in U.S. Primary Care, a cluster randomized trial. Rationale. The impact of screening for chronic obstructive pulmonary disease, COPD, on U.S. primary care clinician behavior and patient outcomes is unclear. Objectives. We sought to assess the impact of receiving screening scores for clinical and patient outcomes using the COPD assessment in primary care to identify undiagnosed respiratory disease and exacerbation risk, capture, tool. Conclusions. Within these U.S. primary care practices, COPD and capture education plus receipt of capture screening scores did not change clinician COPD assessment or care or patient outcomes for capture plus patients. However, in the pre-pandemic period, capture plus patients were more likely to undergo spirometry referral completion, whereas for capture minus patients, clinicians were significantly less likely to assess for COPD, suggesting that the intervention resulted in a more appropriate use of healthcare resources. Next, we will be discussing articles in the field of nephrology. Here are the articles from Clinical Journal of American Society of Nephrology. Clinical implications of slope of GFR in clinical trials of CKD progression. Key points. Acute effects impact the clinical endpoint independently of treatment effects on the chronic slope. Our findings support the 3-year total slope as the primary slope-based outcome in randomized trials. Here are the articles from Kidney International Reports. Nephrotic syndrome thromboprophylaxis with direct oral anticoagulants or vitamin K antagonists. Introduction. Nephrotic syndrome, NS, is a pathological state of the glomerular filtration barrier associated with an increased venous and arterial thrombotic risk. Current guidelines suggest heparin-based or vitamin K antagonist, VKA, regimens for thromboprophylaxis in such patients. Although widely prescribed for other indications, direct oral anticoagulants, DOACs, are not recommended in NS because of limited pharmacological and safety reports. This study aimed to compare DOACs and VKAs for thromboprophylaxis in NS, specifically regarding thrombotic events, TAs, and bleeding events, BEs. Conclusion. This study provides reassuring clinical data on DOAC use in NS thromboprophylaxis compared with VKAs, the recommended therapy, and calls for confirmation in randomized controlled trials, RCTs, and larger pharmacological studies.
Thank you for listening to This Week in Medicine, your filtered medical journal summary. Have a great week ahead, stay blessed and be humane.